Hello, everyone. Welcome. I'm Henry Lee, Chief Medical Officer of the California Perinatal Quality Care Collaborative. Really great to have you here. You see in front of you, if you just join, a link to a QR code to the pre-webinar survey. Please scan that on your phone if you haven't done that yet, or there's a link that was just placed in the chat as well. We appreciate this opportunity to talk about paid family leave in the NICU. There's been an increasing recognition of the importance of family presence in involvement in the care of their baby in the NICU. And although there are many aspects needed to address improving that, one of them important ones is the ability for a family who is working to have leave. And in many ways, I think today is just the beginning of work in this area, we're really excited to partner with Legal Aid at Work, a wonderful organization that you'll learn more about today, who's had a long-standing history of advocacy on behalf of workers. We'll go to the next slide. And this is our agenda for the webinar. First, we'll have some presentations on research in this area. We'll have a great video from a family member who was involved in the NICU, and hear from their voice about the experiences they've had, and then hear from our colleagues at Legal Aid at Work, including describing a tool, hopefully that could be of use to you to facilitate work on behalf of families. And then we'll have a time of Q&A. So excited to introduce John Feaster and MK Quinn, who will present on some research in this area. John's currently a fellow in neonatology at Stanford after having completed pediatrics residency at Lurie Children's in Northwestern University. He's in the midst of clinical neonatology fellowship and pursuing a master's in health policy at Stanford. Is engaged in research in this area as well as with language barriers on neonatal outcomes. MK is graduate of Johns Hopkins and Harvard, where she received a PhD in population health sciences, and currently a postdoctoral scholar at Stanford, working with us at CPQCC and with ongoing research on the current topic. So thank you, John and MK, for presenting today.
Thank you, Henry. So we thought it was important to first kind of frame this webinar with some of the ongoing research that's going on in the NICU. And I think a lot of us know from anecdotal experience that the impact that family leave has on our patients and families. But from a policy perspective, it's important to have some empiric evidence to help shape the conversation with legislatures. Go to the next slide, please. So first, to start with some evidence from outside of the NICU, there's an extensive body of literature showing, consistently showing benefits of family leave for child health. When we look at FMLA, which was federal legislation that protected family leave, this was unpaid family leave passed in the early 90s. We see that there was a significant benefit for mortality, but that benefit was specifically concentrated amongst college-educated and married women. So people who could potentially afford to take an unpaid leave of absence. When we look more specifically at paid leave, but outside of the NICU, or sorry, outside of the US, in countries like Europe, we see that same trend of decreased mortality after passage of paid family leave in middle and high income countries. California was the first state in the US to pass a paid family leave legislation back in 2004. And there's been some research at the population level showing some benefits specifically on post-neonatal mortality after passage of that legislation. You can go to the next slide. But our research looked to focus on the impacts of California's paid family leave legislation in the NICU itself. We know that our NICU infants have prolonged stays in the NICU. They have unique needs. Parental engagement is essential for their development and outcomes. And paid family leave is an important aspect of a parent's ability to be at the bedside. So the study that Henry and I conducted was to look at the impact of paid family leave legislation on the outcomes of very low birth weight infants in California. And we sought to kind of demonstrate a causal impact of the legislation itself on these outcomes by comparing the outcomes of California infants who were exposed to that legislation with paid family leave versus the surrounding Western US states that did not have a paid family leave legislation. And then we adjusted for maternal and infant characteristics that could influence those outcomes. Going on to the next slide. And essentially what we found in the following 4 slides is that we couldn't show a significant impact from that piece of legislation itself. So the outcomes we looked at were receipt of human milk at discharge, rates of necrotizing enterocolitis, rates of in-hospital mortality, and a length of stay. And you can see here, the dashed line here is the year that paid family leave was passed. And we have our outcomes by year on the x-axis, and then the percentage of infants who were discharged home receiving any human breast milk at time of discharge. The gray line here is the Western United States, and the red line here is California. And we can see that even prior to passage of this paid family leave legislation, there was a steady increase in receipt of human milk at discharge, most likely related to a lot of the QI efforts that CBQCC has had enacted prior to this. Moving on to the next slide. We see similar outcomes when we look at necrotizing enterocolitis. No significant difference, just kind of visually looking at this, and also by statistical methods between the Western US and California after paid family leave legislation. Next slide. Similar for neonatal mortality, and last slide. Similar for length of stay. Next slide. So to broadly sum up our findings, and there's a truncated version, we couldn't demonstrate a clear impact of paid family leave legislation on those selected health outcomes. I think it's important to take away from this is that the outcomes that we selected are the ones that were available within the CBQC and Vaughan research data set, but it's potentially these outcomes are not the ones that would be most sensitive to access to paid family leave. So things like parental engagement within the NICU stay, that's quite hard to measure. Time of skin-to-skin care for these infants, which we know is important for developmental outcomes, and even quantity rather than yes/no presence of receiving human breast milk at discharge would probably be a more accurate measure of the impact of paid family leave. And the other things to consider is that maybe the paid family leave legislation that we have in place right now is inadequate for this unique population. Our infants are staying in the NICU for weeks to months at a time. And these, as we'll come to see, these paid family leave policies only cover a short period of that time. And lastly, I think it's important to frame within the context of this talk is perhaps there's inadequate uptake of the policy. So maybe there are families within the NICU that are eligible for paid family leave and aren't utilizing it for one reason or another. And that falls on us to find ways to connect our families with policies that can be beneficial to them. So our future work, which MK will explore here in a moment, is using more qualitative methods to identify those granular outcomes, which may not be captured in epidemiologic data sets.
Great. So I guess rolling off of that previous research, we're currently conducting or preparing to conduct 2 different studies related to family leave. So the first study has already begun. It's a qualitative study investigating the barriers that families experience when they're visiting the NICU. So for this, we're doing 45-minute interviews with family members of preterm infants at the Lucille Packard Children's Hospital. And we're specifically talking to families with low incomes who are eligible for WIC, so the Special Supplemental Nutrition Program for women, infants, and children. So for this study, if you go to the next slide, we're in the very early stages. So our results are very preliminary right now, but so far we're starting to see some commonalities in experiences. So far, most families we've talked to are accessing all resources on paid family leave through their workplace. Parents report that the payment during leave is insufficient, and this is especially to cover some of the increased expenses that they have for transportation and for visiting the hospital. We've also had multiple parents report financial difficulties due to a parent needing to quit their job. So this was often because either the family was unaware of paid family leave, that it was available, or because paid family leave was too short and it had ended. We're also seeing that some parents are deciding to save paid family leave for when the child will transition home, and thus aren't able to visit very much during the NICU stay. So we're expecting to have a lot more results on this study, and we'll be able to share them later on this year. So for the other study that we're planning to conduct, this is going to be a large survey of parents with preterm infants in the NICU, and that's to understand the experience of a more broad swath of families across California. So for this study, we're planning to survey at least 530 parents of preterm infants. We're going to ask several questions, but for those related to family leave, we're going to ask about the knowledge of family leave programs, the barriers to using family leave, whether they used family leave, which family members took it, and when they chose to take it. We're also going to ask about the frequency and duration of their NICU visits, their demographics, and income. So the goals of both of these studies are to understand the unique paid family leave needs of families in the NICU. We're also trying to understand how racial and ethnic inequities in paid family leave contribute to the ability of parents to visit the NICU. Finally, the information of this research could help us advocate for better policies for families with children in the NICU. And if you're interested in contributing to this research here or knowing more about what we're doing, when we send out the post-session survey for today, we'll have a spot there where you could provide contact information. We're especially needing help to recruit NICU families for that large survey. So if that's something you think that you'd be interested in, if you put your contact information in, we'd appreciate that.
Thanks, MK and John. It's really exciting to hear about the research that you guys are doing and planning to do, because I think that can have big impacts on legislative action and ways that we can demonstrate the importance of paid family leave. We really wanted you guys to get to hear from a parent today, since this is our focus really around this important topic. And so we're excited to share with you a very short video from Legal Aid at Work from one of their clients. So I'll play that now. And then after that, we're going to hear some of the nitty-gritty details around paid family leave, who qualifies, how to access it, and we'll also share our handout with you.
I had started feeling a little sick. I was feeling a little off. And in the middle of the night, my fiance ended up rushing me to the nearest hospital. And that's when they told me that I was about 4 centimeters dilated and that the baby wanted to come out. He was at the time 25 weeks and 1 day gestational. And from there, it was really mind-boggling to me, like really to the point, everything was like a blur. And feeling that sense of, uncertainty, dread, and fear mixed in. First thing I thought was, shoot, how am I going to get a hold of, my management to let them know that this unexpected arrival and my need to activate my maternity leave. But at the same time, I was scared. And then that honestly got shoved all the way in the back of my head because I was more focused on increasing the chances of survival for my son. Once I spoke with HR, I felt like the situation went from supportive to it shifted. It definitely shifted. But for this to happen when my son's life was on the line and I'm in this whole basket of just somewhere between fear, despair, anxiety, frustration, depression, and uncertainty, I really felt like that all just kind of fell apart from the bottom, and they didn't really, in a way, support me how I was expecting it. I really felt betrayed. The head surgeon who specializes with micropreemings had directly called me and said, you need to come in. I believe he's in bad need of surgery, and if he doesn't receive the surgery, he can potentially get even more sick within the next several hours. I felt like I got slammed, by a freight train. And then all of a sudden, and out of nowhere, I get terminated. I had received that during his surgery. I had received a notice during his surgery, and I got so mad, I literally had to just leave the room to breathe. So you can imagine the amount of stress getting piled on of just, oh, crap, I just lost my job. My son's in surgery right now, fighting for his life. How do you climb out of that hole? Especially when you have an obligation to your job, but then you have an obligation to yourself as the person who's going through this trauma, and an obligation to your family. My attending doctor who was going through the approval with EDD had said that she felt like something was off, and I'm not understanding why they had terminated you while you're on leave, but I would strongly suggest that you look into it. At the time, I had so much on my plate, and I didn't want to go through the whole seeking legal advice and having to talk with an attorney. But after much continuous mental straining from not having a job, and then of course my personal funds going down, my therapist in particular was like, give it a try. It's like, it's important that your rights as a worker are protected, especially when you are a parent of a NICU baby and this is going on. That's the last thing that should have been on your plate. Family leave, I believe, is very important. It's critical because it allows the parents to be there and to focus on their child in the NICU. It could be basically a big difference between being able to be at the bedside of your child or being in the position where you have to go back to work. A lot of the bulk when it came to FMLA or paid family leave was primarily through your social worker. Even if a NICU doctor isn't as knowledgeable as a social worker when it comes to the ins and outs of paid family leave, they can approach the social worker and say, hey, Dr. So-and-so mentioned that there is paid family leave available. How can I start that process and when can I start it? So I encourage a lot of parents of NICU babies to be able to reach out to their hospital social worker as soon as possible and see what they qualify for. And if they have any hiccups in between with communications between their job management or HR and that of the NICU, the social worker becomes that much as an important. I hope that, with my story and my son's story, that there are people, loving, caring, supportive people out there who are willing to step up to the bat and support them 100% of the way. I want parents to remember that their job primarily is to be a parent, and don't be afraid to speak up when you're not sure about something. Because if I wasn't encouraged to speak up, again, we would be talking a totally different tune and situation. A year ago, I wasn't sure if he was going to even make it before he came out. To see him so vibrant and full of life, I am very grateful for everyone who has been involved in this journey and continues to be supportive as my journey and journey with my family continues on.
I am so grateful for stories like these and for parents who are willing to share such really inspiring stories that prove the worth of paid family leave and that time with their infant that is really just irreplaceable. I am excited to introduce Dr. Laura Rose to you now. She is a second-year pediatrics resident at Stanford Children's Hospital, and she has a strong passion for advocacy. She's going to give us a better understanding of what paid family leave in the NICU looks like and why it is so important.
Thank you so much, Caroline. Can you hear me okay?
Yes, loud and clear.
Perfect. Great. It's so nice to virtually meet everyone. Thank you for giving me this opportunity. I just wanted to briefly talk about the ins and outs of paid family leave. I know as many social workers are on this call and you probably know most of these details, but I figured that getting everyone on the same page would be really great in order to be able to advocate best for our patients and families. Next slide. So I think, thank you, John and MK, for talking a little bit about this. So I believe that paid family leave is important personally, but then we've also seen multiple benefits, both from the entire family, right? And then also from the maternal side and then the infant side. And all of these things kind of coalesce into strong benefits for the family. But I think that things to really point out here are that paid family leave allows each family to maintain or achieve some sort of balance between caregivers who are able to support children who are ill, in this case in the NICU. And then we see that, and in that video, I think it was strongly illustrated that moms who are able to get paid time off work are going to be experiencing hopefully less stress and anxiety and are going to be able to be more present and involved in their child's care. And then we've seen, I was just going to say, we've seen multiple impacts in child and infant health as well. And thank you, John and MK, for going through some of these. Next slide. Perfect. So I just wanted to walk through briefly some objectives after my quick session here today. The first is to know exactly who qualifies for paid family leave and recognize when these accommodations can help patients, to understand the process for obtaining family leave and then help connect patients and their families to services, and then also to help patients, in these cases parents, get necessary certifications that will aid them in applying for paid family leave. Because as we hope that doctors and social workers are able to take the initiative and provide these services outright. I think the more that families know about these services, the better they're able to advocate for themselves. Go ahead. Okay, so I initially did a similar talk with my pediatric resident cohort, all of my colleagues who are residents in pediatrics, and it was very striking how little we all know about paid family leave. I bring this up really to say that my colleagues and I have extensive medical training, and yet we have very little training, if none, in this topic. And so it's a personal goal of mine to not only educate all of you, but also to educate my colleagues into this process, because we'll all encounter patients and families who would benefit from these services. You can see that most of us had heard nothing about paid family leave when I did this lecture. Next slide. Okay, I wanted to make this a little bit interactive. So here is a true or false question. And just to test your knowledge here, are caregivers, other than parents, able to take extended time off work to care for children with serious health conditions? Is this true or false?
I'll give you about 10 more seconds.
Awesome. Okay, so I see that 82% of our participants here said this was true, and it is in fact true. And this is under the California Family Rights Act. I think most people who refer to it as CFRA. And this provides 12 weeks of job protected time for family members that include parents, grandparents, and siblings. Of note, this is unpaid. But what is nice about this is that family members can take it in increments of their choosing. So you can take a few hours at a time, you can take days at a time, or weeks at a time. And then the paid component of this, if you would like to receive pay while you're taking your job protected time through CFRA, is through paid family leave. And you can receive up to 8 weeks paid at 60 to 70% of wages. And this is through the Employment Development Department. Next slide. Okay, great. Let's do one more poll here. Thanks everyone for the participation. True or false? Is paid family leave only available to documented workers?
Five more seconds here.
All right, so a little bit more variability here. Excuse me. It looks like 62% say that that's true and 38% say that it's false. It's actually false, and it's a right that is considered a public charge benefit. And so both documented and undocumented workers are able to utilize paid family leave. Next slide. Okay, so I wanted to shift gears a little bit into talking about pregnancy disability leave, because this is something that we see in the NICU. So when a parent is quote unquote disabled by pregnancy, childbirth, and or recovery, they're eligible for 4 months of pregnancy disability leave, up to 4 months of pregnancy disability leave. Similar to what we were talking about before, this is still unpaid, but it is job protected time off. And this, you can qualify for this up to months before delivery, during childbirth, and then also during recovery if your team deems it's necessary. And of note, that's I think very important, is that moms are able to continue their health insurance benefits during this leave. So I think that's very important. And it is tacked onto, or at least it's separate from, the caregiving or bonding leave that parents are also entitled to. Similar to before, as we talked about, where you're able to receive payment for at least part of the time that you're on pregnancy disability leave, you're able to receive partial pay through state disability insurance. Next slide. I apologize, this is a little fuzzy, but this is just showing in graphic form kind of essentially exactly what I just mentioned, which is the component of pregnancy disability leave, which provides up to 4 months, and then the state disability insurance, which will provide the payment or your income, 60 to 70% of your weekly wages during this time. Of note, I think this is a little bit of a logistical point that's important for families to know, is that it only starts qualifying after a 1 week waiting period. And so that's important to let families know. Next slide. Alrighty, and then, so we talked a little bit about this, which is how many weeks parents are able to take job protected leave. And this is specific to California. And this is 12 weeks through CFRA. And again, this is job protection, not income support. And this is then in addition to what we were just speaking about, which is the pregnancy disability leave. And just as a review, income support is through paid family leave, and health insurance must be continued during this leave. Next slide. Thank you. And this is just a little bit of a review of what I just mentioned, which is that sources of income for caregivers who take leave include both the state disability insurance and then also paid family leave. Both are state funded and through the EDD, but state disability insurance is only available when the parent is disabled by pregnancy or in this childbirth period and recovery period. Next slide. This is a graphic demonstrating just kind of what I mentioned, similar to the prior. It's kind of nice to compare. If you want to have these slides later, I think that Legal Aid at Work group would be happy to share them. You can go to the next slide. And so I wanted to go through some examples because I think sometimes it's one thing to talk about these, but it's another to look at a specific case and really understand what an example family would qualify for. So let's walk through a typical pregnancy. So in a typical pregnancy, a mom can elect to take 4 weeks before her baby is born, and then let's say 6 weeks after birth to recover. And that's through paid disability leave or pregnancy disability leave. And sorry, it's paid through the state disability insurance, as we mentioned. This component is separate from the paid family leave, which comes kind of next. And this component requires a note from a physician in order to qualify. The bonding time, which is through CFRA, is not required. There's no medical note required. And then you get paid through paid family leave for maximum of 8 out of the 12 weeks. Next slide. Looking at kind of what typical leave looks like for new moms, you can see that there's women who have C-sections tend to be eligible for a few more weeks of benefits. Vaginal delivery moms obtain about 6 weeks of benefits, up to 4 weeks prior to delivery. And then in a C-section, it's typically about 8 weeks, which is 4 weeks prior to delivery and 4 weeks after. And then you can then add in 8 weeks of paid family leave after baby's born, which would give you, for a vaginal delivery, would give you 14 weeks of paid leave with an additional 4 weeks of unpaid leave. And then as above, you just add 2 more weeks to that for a C-section. Next slide. So I think many of you have had patients who are families who have preterm babies. And for that case, I wanted to walk through someone other than a mom and looking at what family leave would look like for them. So let's say a baby is born 8 weeks premature and admitted to the NICU. Dad wants to take time off work. And he actually doesn't want to take full days at a time. He wants to take it in smaller increments. So let's say that this dad, he wants to take 2 hours off work per day. And he wants to do that through the NICU course. So if the baby's discharged 8 weeks later, doing math really quickly, you realize that he's taken about 80 hours during that time, which is about 2 work weeks. So he's eligible for up to 10 more full weeks of leave after baby goes home. And again, he can receive pay through paid family leave for 8 weeks. And then all of this time, he is job protected. Next slide. Quickly, there are other caregivers are eligible as well. So let's say a grandma comes to visit this baby when the baby goes home. She's eligible for 12 weeks of CFRA leave from work. And also, again, the 8 weeks for paid family leave, but a medical certification is required in this case. And then I just want to mention this is on top of paid sick days. So if all else fails, or if a family needs more time in addition to what leave they've been provided, you could always query how many sick days they still have available. And then I just wanted to throw out there what California is doing in terms of policy proposals to make paid family leave more accessible. I know there's been a lot in the media recently, but one bill that is promising is the Bill 951, which would increase wage replacement rates for paid family leave and state disability insurance to 90% of income, especially for these low to mid income workers. And I think that's very critical because many of our families, we hear that they aren't wanting to take this leave because 60 or 70% of their income is not enough to live off of. And so if they are eligible for 90% of their wage during leave, this may actually make a very significant difference in their ability to take time off. So I would love to see this bill in action.
Thank you so much, Laura. That's really great. Sort of a summary in a quick time of the policies. And you probably already recognize this is not even designed for families who have a baby in the NICU. So we probably need to do more, but at least we could do what is available now. So next, I'm really excited to introduce our colleagues from Legal Aid at Work, Sharon Kerman and Katie Wuchiet. Sharon is Director of the Work and Family Program and Senior Staff Attorney at Legal Aid at Work. She is an expert on family and medical leave policies and has helped craft several landmark laws improving California's work-family policies, including expansions of PFL to cover caregiving for siblings, grandparents, grandchildren, parents-in-law, as you've heard, and increasing the benefit amount, especially for low-wage workers. Katie is also a staff attorney with Legal Aid at Work, and she provides free legal services, including representation and technical support regarding rights of sexual assault, domestic violence survivors, as well as workers struggling with family and medical crises, and pregnant workers and new parents. She also advocates for stronger workplace rights to accommodations, paid leave, and flexibility at the state and local level. Thank you, Sharon, Katie, for being here today to describe your ongoing work in this area and informing us about workers in the NICU and these important topics.
Thank you so much, Dr. Lee. It's just been such a pleasure to work with you and your colleagues and everyone who's been a part of today's webinar, and so appreciate your leadership in really trying to find ways to improve access to paid family leave in the NICU and support the well-being of families. So I am really, really happy to be here with all of you today. I'm going to share a little background on Legal Aid at Work and the resources we offer. And then Katie will share about a new resource that we developed in partnership with the CPQCC to educate families of babies in the NICU about their rights. So Legal Aid at Work is a nonprofit legal advocacy organization. We've been around for over 100 years. We serve folks all throughout California with a special focus on workers and families with low incomes. And our work and family program empowers workers who are pregnant or parenting or caring for loved ones or dealing with their own illness to make sure that they have the leave and the accommodations they need so they can take care of themselves, take care of their families without having to sacrifice their jobs or their income. Just to say a little bit about our services, so we provide free, confidential legal advice through a statewide work and family helpline. And so on this helpline, any worker can call from around the state with questions about their right to time off work, to pay during the leave, to pregnancy or lactation accommodations or related issues, and they will receive specific practical and legal information and advice within a couple of business days. And we provide these services for free in multiple languages, and it's confidential. We also represent workers whose rights have been violated, including the mom whose really powerful story you heard today. So that means that we will often, write letters to employers trying to get workers their jobs back or the accommodations or leaves they're entitled to. We will file administrative charges, try to negotiate with employers, and when necessary, we will also file lawsuits on behalf of workers. In addition to that work, we also advocate for policy and systems change to improve access to leave and accommodations for marginalized workers. And you heard a little bit about the complex web of rights that exist. We were one of the organizations that actually helped to pass the first paid family leave law in the country. And ever since then, we've been working with our partners to try to really make it more accessible, more equitable, particularly for low-income communities of color. And one of the ways that we have really worked to improve awareness and improve access to paid family leave is through partnering with healthcare and social service providers to really try to meet patients and families where they are and where they're already receiving care, and working with those trusted messengers like social workers in a clinic, for example. We, in 2014, partnered with the women's clinic at Zuckerberg San Francisco General Hospital to both provide training and technical assistance resources to providers at the clinic, as well as legal services and information to workers and patients and their families. And then we've done similar partnerships like that in collaboration with WIC, for example. Have also worked closely with UCSF and have conducted a number of just individual trainings for providers and health systems throughout California. Next slide, please. And then I just wanted to share a couple examples of some of the resources that we have available at Legal Aid at Work. And we've created a variety of Know Your Rights resources like the ones shown here. So we have a Pregnancy and My Job fact sheet, which shows the rights of pregnant workers. And the other side of that fact sheet shows the rights of all parents. And then this roadmap, which comes with an accompanying guide to really walk folks through step-by-step of what rights they have available and how to access them. When do you talk to your employer? When do you apply to the EDD for your benefits? How do you do it? What do you say? So those resources are available in multiple languages. And we have other step-by-step guides as well, including a guide, for example, on how undocumented workers can access paid family leave and state disability insurance. And then the next slide shows that we have on our website also a number of sample letters, both that workers can use to, for example, request leave or request accommodations. And then also we have a number of sample letters for healthcare providers. So they can certify their patients' needs for these protections. And then as the other piece of that work is that we're available as well to provide technical assistance to providers and social workers who can, for example, call us up and say, I have a patient in my office and she needs, help figuring out how to fill out this paid family leave form, or she's facing these specific barriers, and then we will provide that guidance. So with that, I will pass it to Katie to share more about the new resource.
Thanks, Jaren. So as we shared these resources, we did get good feedback from folks generally. I can tell you there's a handful of providers and social workers that have the Pregnancy Plus My Job chart pinned up inside their cube for when questions come up. And I know of at least one clinic where they laminated the timeline that Laura shared to just have that as an example to show any patients that came in. And as a part of this outreach and education, we ended up hearing more and more questions from families and providers, which you expect. Every family has different needs, so no matter what tools you create, there will always be some additional questions. But what we found was that these were especially coming up for NICU families because their needs tended to be so significantly different from those involved in a typical pregnancy. 6 weeks to recover from pregnancy and 12 weeks of bonding may be enough for some families, but for families with NICU babies, the babies may still be in the hospital at that time, or if they're going home, they likely have continued significant health needs that have to be addressed by a family member and that a daycare isn't able to meet. So because of that, we partnered with Dr. Lee and CPQCC and other healthcare partners to create a fact sheet directly targeted towards these families, titled Workplace Rights, NICU Support. So we started by pulling together all of the questions that we've heard from clients and patients and healthcare providers, trying to organize it to be as simple as possible while still covering the complex web of laws that families do need to know about. And then to make sure that it really was meeting the needs that were out there, we also shared it with NICU social workers at Lucille Packard Children's Hospital, as well as at UCSF. And with their help and feedback and advice, we came up with this fact sheet. And our hope is that this is something that'll be helpful for you in your work. And it will be available to you after, so you'll have the chance to read it and review it, learn it as well as you want. But I thought I'd go through it quickly and kind of give you a preview of it. Next slide, please. So it's divided up into 5 sections. The first covers what steps new parents and caregivers need to take. Because we found it's important to know what rights are available, but if you don't know what it is that you have to do to access them, to talk to your employer, to apply to the EDD, they don't end up having the effect that we want them to. After that, it goes through the specific rights of a parent who's pregnant and gives birth, as well as the rights to leave and pay for family caregivers and other parents that don't give birth to bond with that child. After that, it goes into some frequently asked questions, and then it ends with a few sample timeline scenarios to explain how this ends up working out in practice. Next slide. So the FAQ addresses the questions that we saw arise the most frequently, which is just how to make sure that someone's job is safe when they need time off, how they can get paid, that critical question of how do you make sure that you continue to have insurance during that time, as well as some that relate to going back to work. So, what happens if your employer pushes back or doesn't listen or says no, as well as if you need to express milk at work, how can you do that? And what are your rights? Next slide, please. And it finally ends with a couple of timelines like the ones that Laura shared earlier. So it includes timelines for a normal pregnancy, for a parent who's bonding with a child that is born prematurely, as well as for a caregiver who comes into town to help care for that child. But it also includes some of the more complicated pregnancy-related scenarios. So one of the ones that we include is for someone who has complications early on and needs to take more time off before they have their baby. And how does that impact their ability to take time off once their baby is born and to bond? And next slide. And then another scenario goes through, what happens when a baby is born unexpectedly and early on? And what does that mean for the parents who want to be there to take care? Can they take more time in that scenario? Can they take less? What do they have to do to access that leave and pay? And I won't go through them in detail, but they'll be available to you. Next slide. And with that, we'll have time for question and answer. I already see some great questions coming in the chat, and we want to make sure there's time to address all of them. So thank you.
Thank you so much. That was really great. I know this is a lot of detail, and I know that people in the Q&A, it seems to have a lot of very specific questions. So I want to go ahead and get started with those. I'll welcome back all of our presenters to hop on and invite you to answer these questions. I think you've covered this, but just to further clarify, can parents get any more leave if their child is in the NICU or if they're a micro preemie compared to if the child is born full term?
I'm happy to address that one. It's a little complicated. So there's the California Family Rights Act, which gives somebody the ability to take 12 weeks off in a year that can be used to bond with a baby, to take care of a family member that has a serious health condition, or for your own health need that isn't pregnancy related. So beyond those 12 weeks, there's not like a specific bucket of leave that's available for additional family caregiving for that one parent, because there's that longer list of family members. Parents and grandparents can kind of sub in and out and take that time. But beyond that, additional leave is limited to what's needed for that parent's own health. So we've seen a lot of scenarios where, someone who gives birth to a baby very early on and is dealing with those stresses might need additional medical leave for their own health condition. So when those circumstances come up, it's always good to talk to the healthcare provider. Anyone's welcome to reach out to us and we can kind of give tips on how to navigate it, because I think that's one of those places where our laws could be better, but there are ways to support families the best you can in that circumstance anyway.
Thanks, Katie. What about if parents aren't married?
Yeah, that doesn't matter whether they're married or not. Each parent is entitled to the leave and benefits that we talked about today.
Great, thank you, Sharon. Many of my parents are in the low income category. If they apply for these services, is it their employer that covers their partial salary, or is it the state? I feel they will be hesitant to apply if their employers need to cover the cost.
Yeah, that's a really important question. Thank you for asking it. So the paid family leave and state disability insurance programs that provide partial pay while workers are on leave are entirely worker funded. So employers do not contribute to those programs. Workers apply directly to the state employment development department and they receive those benefits. The only exception to that is in San Francisco, where there's a separate law that actually requires employers to top up the paid family leave benefits. So paid family leave is currently only 60 or 70%. And then workers in San Francisco who are eligible would be entitled to the remainder from their employer, but there is an anti-retaliation provision. And so they shouldn't be retaliated against, but totally understand that concern. If anyone has questions about that, again, they're welcome to call us.
And just tying into that, I'll say that's one of the reasons that we think it's important that everybody know that folks who are undocumented also qualify, because it is just like every time somebody gets a paycheck who works for a private employer, this little 1% or around that goes into this fund so that if they ever have to take time off for their health or to bond, they can get some income during that time. So all workers are paying into it, and it's important that all workers are able to access it. It's not a state paid benefit, it's not an employer paid benefit. It's something that folks are investing in out of every paycheck for their future needs and for their families.
That's a great clarification. So another question, I just learned that if both parents have the same employer, the paid family will be shared by them. If they have different employers, are they entitled to have up to 12 weeks of paid family leave for each parent?
That's a great question. So I know an earlier question was, okay, FMLA and California Family Rights Act, what are they? What's the difference? So California Family Rights Act is basically like the FMLA, but it's a little bit better. We've improved it over time. So for example, it applies to people who work for employers with 5 or more employees instead of only 50 or more. So another one of the improvements in the California right to leave is that I think, in 2021, that was the first year that we got rid of that 12-week split. So even if both parents work for the same employer, they both have the right to take 12 weeks off under the California Family Rights Act, and they can both get 8 weeks of pay from the state through paid family leave.
That's really helpful. Is there a way to connect NICUs with legal aid at work through CPQCC? If someone has an urgent need, what's the best way to get in touch?
Yeah, I think what we're making these connections now, I guess, by having this webinar, and I don't think you need to go through CPQCC now that you've gotten to know Sharon and Katie and Legal Aid at Work. There's that that phone number, at least I guess to connect. I think it seems like a great sort of resource that I think they're welcoming you to contact them if you have needs for your families.
And the confidential helpline is, I included the number in the chat. You'll also get links to all of the handouts that were mentioned in the follow-up email. So let me go ahead and move on. There's another question here. Does an unmarried partner qualify for job protection to care for a mother who is hospitalized prior to delivery?
Yeah, that's a really important question. So the family members who are currently covered under the job protection law are spouses and registered domestic partners. So if they are registered domestic partners, they would be able to take leave to care for the partner who's hospitalized, in addition to some other folks that we already mentioned, grandparents and siblings and things like that. But so there is, though, an effort right now underway that we're involved with our coalition partners to improve and just basically make the definition of family more inclusive, so that really the employee could choose the person for whom they want to care, and it wouldn't matter whether they have a legal or biological relationship. It's this concept of chosen family, which is super important. So happy to share more about that legislative effort to improve access as well.
Yeah, that's so important. Here's an interesting question about research. So are there plans for further research among NICU social workers, or to have that research replicated in the PICU or in inpatient pediatrics? Are there any plans for parallel or follow-up questions through CCS?
Yeah, no, thanks for that suggestion. I guess I don't think we have any exact efforts yet, but we're hoping to do more. I think actually the PICU is a really great opportune partner, because families with patients with children in the PICU will often have similar issues with taking off time from work. Yeah, I don't know if anybody else has any thoughts.
All right, thanks, Henry, for clarifying. Someone asked, does Legal Aid at Work offer different languages for the helpline? I know the answer is yes. Do you guys want to expand on which languages are offered?
Yeah, we have folks on staff who are fluent in Spanish and Chinese, but we use a language line service for any other language that somebody wants to call in. And so if somebody wants to call in, we'll find a way and use interpreters to make sure we can provide services.
When does the 12-week job protection reset? So if a baby is born in December, would an additional 12 weeks be added in January? That's a good question.
That's a very good question. So I should say that, first of all, that the 12 weeks of bonding leave is really meant to be completed within the first year of the baby's life. And so that's kind of the first set of 12 weeks. And then if the child has ongoing health needs that require care, later in life, then there would be another 12 weeks each year available to parents to take leave to care for that child as long as they're otherwise eligible for the leave. And as far as like when the leave resets, it's a little bit more complicated. It kind of depends on what the employer's policy is. Employers are able to essentially set the leave year. So they could decide, and they're supposed to tell you what that leave year is, but it could be calendar year, it could be based on when the prior leave was taken. And if they don't tell you, they haven't chosen a leave year, then you get to choose the way that's most beneficial to you.
That's great. And are caregivers able to work until their leave is approved?
Not sure I understand that question. Maybe if the person who asked it can say a little bit more. Or maybe if you understand, Caroline, what they're getting at, I'm happy to.
Yeah, no, yeah, feel free to comment a bit more if you can clarify that. And I'll give you a little time. We've got one other question to ask here. I think you addressed this a bit, but just to further clarify, can this leave be dated back? So when the mom gets time off, sometimes she requires bed rest or needs, up to 2 months even before the baby is born. So can this be dated back?
Yeah, so that's a great question. Paid family leave, you can apply up to 41 days later after your leave began, and even later if you have a good reason for not having applied sooner. So what you would recommend is just attach a letter to your application and explain, what your reason is for having applied late, and then that should be fine. And then similarly for state disability insurance, if you didn't get around to applying on time, you have actually 49 days as a matter of course, or again, longer if you have a good cause, good reason.
I know someone else had their hand raised at one point during the presentation. So if you do have a question, please use the Q&A form to submit those to make sure that we see it. And I think at this point, all of the questions that have been submitted have been answered. We are so grateful. If you have another one, we have a couple more minutes here at the end, so feel free to submit it. But I'm really grateful to have this team. I think this has been a really informative session. So you will receive a link to a post evaluation, and there's also room in there for you to include your email address if you're interested in supporting some of the future work that MK mentioned earlier, or if you have any other questions about how you might get involved with that or have some of your families involved in that work. You'll also receive links to all of the handouts that were mentioned today. I would really encourage you to print those out, put them up in places where you can see them and your colleagues can as well. This is an area where a lot of staff and providers, haven't been formally trained in. And so there's a lot of opportunity for growth. And we'll also have the recording up of this, and that will be sent out as well in the follow-up email. So with that, I think we will stop with the questions. And yeah, thank you guys so much for coming and for attending. I've really enjoyed this session a lot, and I've learned a lot myself. Yeah, thank you so much, everyone. Enjoy your weekends. Bye-bye.